So our first speaker is Nieves Amat Camacho. Nieves is a nurse with clinical and global health experience with MSF. For 7 years, she worked as a researcher at Karolinska Institute in Sweden on health preparedness and response to emergencies. She is currently working on her PhD in Italy, focusing on infant feeding practices in humanitarian contexts. Today, she will talk to us about breastfeeding promotion and support in Maiduguri in Nigeria. Thanks and welcome, Nieves. Looking forward to your talk.
Thank you so much, Myrto, for this introduction, and good morning to everyone. It is a pleasure to be here today to present our study, which looked at breastfeeding promotion and support in Northeast Nigeria. So to give you a bit of a background, it is recommended that breastfeeding is protected, promoted, and supported for all infants in emergency settings, where access to safe breast milk substitutes, potable water, and hygiene is often restricted. At the same time, the establishment of exclusive breastfeeding is considered a central part of the management of malnourished infants under 6 months. Still, in spite of the importance of this topic, very scarce literature currently informs about the feasibility and effectiveness of breastfeeding promotion and support in humanitarian settings, or how those are perceived and accepted by caregivers in such complex situations. Thus, the aim of our study was to explore caregivers and health workers' perceptions and experiences of breastfeeding promotion and support in the context of an MSF OCB nutrition project run in Maiduguri, Northeast Nigeria. This setting has been affected by a conflict for over a decade and is shaped by recurrent epidemics, population displacement, and food insecurity. It is estimated that only 29% of infants are exclusively breastfed in Nigeria. The project we focused on in Maiduguri provides ambulatory and inpatient care for malnourished children with a dedicated ward for infants under 6 months, as well as outreach health services in 10 informal IDP camps. Within this project, breastfeeding promotion takes place in the community and at the hospital, involving community health educators and health promoters. Breastfeeding support during admission of malnourished infants under 6 months involves frequent encouragement of breastfeeding, assistance on breastfeeding technique and breast stimulation, and appropriate nutrition and rest, as well as mental health support. Data collection for this study included in-depth interviews, focus group discussions, and non-participant observations. A total of 32 participants, as shown in the figure, were recruited at MSF facility, both ATFC and ITFC, and in one IDP camp. The data was analyzed using reflexive thematic analysis, directly from audio recordings. In terms of participant characteristics, interview mothers were mostly illiterate and generally grand multipara. None of interviewed caregivers with malnourished infants were providing exclusive breastfeeding on admission. Our results, summarized in this thematic map, re-emphasized that breastfeeding practice does not only rely on mother's knowledge and wishes, but it was experienced, encouraged, sustained, or discouraged by the family and the community. We found a widespread perception of breast milk insufficiency, often related to poor maternal nutrition and emotional stress, or triggered by inadequate breastfeeding practice or maternal illness. As a response to this perception, most families directly provided the supplementary feeding with affordable liquids or foods instead of looking for breastfeeding support. In terms of breastfeeding promotion, communities seem generally open to breastfeeding promotion messaging, and families were willing to uptake recommended practices. Identified enablers for behavior change included involving key community members, traditional healers, and family members, and using examples of successful cases within the community. Health workers still felt that breastfeeding promotion messages were sometimes quite generic and did not always target specific issues addressing the causes of suboptimal feeding practices. The provision of breastfeeding support as part of the management of malnutrition presented some challenges in this context, including mothers' expectations of formula provision on arrival, cultural differences, including languages, different languages and gender issues, mothers' vulnerable emotional status on admission, and a prolonged length of stay. Health workers also highlighted some difficulties around infant formula supply. For example, a lack of established solutions for mothers who are not wishing to breastfeed. Despite challenges, mothers usually accepted the breastfeeding support and follow recommendation in the ward, often thanks to the encouragement from mental health counselors and other mothers, peer support. All interviewed caregivers felt grateful for the comprehensive care provided, included breastfeeding support, and the positive results achieved in both their infants and themselves. On the other hand, most participants feared that the achievements of breastfeeding support gained in the hospital could decrease or stop after discharge when mothers lack access to enough food or constant support. Health workers recommended to improve ATFC ambulatory care follow-up for infants under 6 months and to increase the community management of these infants and their mothers. This study obviously had several limitations, most of those linked to the nature of qualitative research that were tried to be overcome by triangulation and other ways. Still, we can conclude that breastfeeding promotion messages need to be tailored to specific breastfeeding barriers. In this context, particularly focusing to address perceptions of breast milk insufficiency, which in this setting is closely linked to poor maternal nutrition and other contextual factors, these perceptions. The provision of breastfeeding support among caregivers of malnourished infants is well accepted in this setting and seem to lead to improved practices. Yet, future quantitative research is needed to assess the real effectiveness of breastfeeding promotion and support to change breastfeeding practice and whether these changes are sustained over time or not. Thank you.
Thank you so much, Maria. Nieves, that was so interesting because one of the things that I find particularly interesting and important is that we move or we join qualitative research to quantitative research. Too long have we just relied on quantitative research, and important to see how the community needs to be engaged. You very clearly stated that a lot of our work and emphasis needs to be on further work in the community, and it needs to be tailored specifically and not be generic, if I understood you correctly. Could you please maybe give a couple of examples of how this could be tailored specifically to the mothers? And you also talked about the healers, traditional healers, etc., how this was done, how you included them. Thank you.
Thanks for your question. So yes, some examples, as we know, the reasons for feeding practices, the determinants for different feeding practices are multifactorial. And sometimes we are targeting some causes, but it's not the cause that particularly affects this woman or this community. So in this case, for example, there is a very, very extended perception that mother's nutrition will affect breast milk and breast milk production. So it's very important that in this context, these messages are clearly given to mothers, understanding their nutrition situation in the community. So they know, they have the information, and they can do according to that. But generic, often their perceptions overcome knowledge. So even if they know what practice is best or is recommended, they needed to understand how to undertake that practice in their situation, in their context.
Mm-hmm. Yeah, thank you very much. Thank you very much. I'm just looking if there is any other questions from the audience. Please don't forget to put, or it might be a little bit unusual, but put your questions in the Q&A box so that I can see them, and then I will ask the questions orally. I will speak to the audience. I'll be your microphone if you want. Just one last question: how does what you found in your research compare with the global research on that topic? I imagine, although there might be not that much, there will be some research on that topic. Thank you.
Yes, thank you. Yes, indeed, the issue of these perceptions of breast milk insufficiency, it's very standing, and it is one of the main reasons preventing exclusive breastfeeding among mothers worldwide. This is very general, so it's really something that we should put an effort on because it's quite global, and we will find it in many MSF contexts. And yes, there is not so much research, but also in food insecurity settings, these perceptions of maternal nutrition affecting the breastfeeding, or even their stress. They feel emotional stress due to the displacement, the loss of livelihoods, the struggles in life to look after many children in this situation. This is also preventing them to feel capable to breastfeed their infants.
Sorry, I was muted. Thank you. Thanks again, Nieves, and I look forward to further research to that topic. That is so important.